everybody. Welcome back to another episode of The Skeleton Crew. This is Jen Callahan. I'm here today with Morris Panner. He's the president of Intelerad. I'm so happy that he's taken the time to meet with me on this chilly Philadelphia day where I am. Morris, thanks for being with me.
Thanks, Jen. It's a little chilly here as well. I'm outside of Washington, D.C., so we're about 2 hours apart by train, but it's a similar climate.
Morris, could you just give us a brief overview of the Intelerad company?
Yeah, so we are, first and foremost, for all of you out there, we are a PACS company that has a industry-leading work list, as well as an image exchange solution and a series of cardiac imaging products as well. So we are core to the day-to-day workflow of RAD groups, imaging centers, and then hospitals. And we just announced a $50 million hospital win. So we are feeling like we are getting some real momentum at our backs. So it's a good time to be on.
That's awesome. So your company is about 20 years old. I was looking on your website, right?
Right.
Yeah. Were you the startup behind it?
We are a classic, what's called a PE-backed company, and there's all sorts of interesting commentary these days about private equity and healthcare. But we were started where a couple of companies come together. So I joined this company about 2 years ago when they acquired my company, which provides that image exchange capability inside of the suite. But the original platform, Intelerad, was started McGill, and it was one of the early innovators in this space and has grown from there. So a really fun story with some international roots.
All right. So what would you say the bread and butter of Intelerad is? Is it the image exchange or is it the workflow?
It's really the PACS, the workflow and image exchange and storage. Well, everything I said actually is what we consider to be our core. Okay. And it all comes together nicely. I know there's been a lot of talk about enterprise imaging. That's what we do, is we provide that enterprise imaging platform with those components in it.
Okay. Dumb that down for me for a second. What exactly is enterprise imaging?
Sure. So it's the complete workflow. As something comes off the modality, you need a way to route that to the right people to look at. They need to be able to visualize it. They need to be able to then report on it. They need to be able to share it with others. And then they need to be able to enable storage of that. And then from there, you've kind of got your platform.
Now, would that also to aid in, I guess, so the area that I live in, there's probably 3 major health systems. Would that aid in the health systems sharing imaging amongst each other instead of, patient having to go to the hospital, pick up a disc, 100%. And then bring it to where else they're going?
100%. So one of our big initiatives is called Ditch the Disc, something started out by the American College of Radiology and Dr. Geraldine McGinty. And we have adopted that wholeheartedly. And although we're not in the room where I have them on the wall, I at one point put all the CDs on a wall to show how obsolete that technology is.
Yeah.
And we are all about enabling that type of sharing and interoperability.
I think it's important for, as this continues the development, that for providers and offices to share with patients that this is a capability. I was in my department today working, and I feel like patients are so inane to just ask for, can I have my disc? Can you put that on a disc for me? And they're taking the disc to have it for, I hate to say no particular reason, kind of just to have it just in case, which I guess isn't a bad thing. But like you said, you're holding on to all these discs and then what?
So I think moving to digital, making sure the patient has access is core to our mission. And part of what makes our system, we believe, a nice platform is that it gives both the doctor as well as the patient access, and they can share it, they can collaborate on it. And that is really the essence of being able to get other opinions or just being able to make sure your health record follows you as you need it to.
So the health system that I work for, they use the Epic charting system. I think that probably the majority of the health systems that are in this area, I think use that. So it's great that they call it Care Everywhere that's on there, that doctors from this health system can look at information from the other health system that the patient might have possibly not chosen to get treated at, but maybe it was an emergency situation that they had to go to. But like you said, being able to access your information.
And so one of the nice things is we integrate into that system. And so in some areas, so New York City, for example, if you're in one of the major health systems there, it will pop up in your Care Everywhere application and you can kind of look at it. Interoperability with other systems is also an important part of what we do, including Epic.
Is that a newer development, doing Care Everywhere, integrating with other systems? Is that a newer concept?
Yeah, it is. And some of that's been driven by some of the ongoing regulation, which requires people to have access to their health records. It's a little different for imaging, so it's not as smooth yet for imaging, but certainly one of the drivers of making information more accessible has been federal regulation around it. So the fact that you're seeing it and feel like it's different than it was, you're right, it is.
That's interesting that there's a federal regulation behind it.
Yeah, it's an important part of 21st Century Cures Act that is enabling more access to information, really trying to empower the patient.
We were talking before we started recording, everyone, that Mars had a great idea to share or for us to discuss about how someone like myself who works in healthcare, I've been in the field now for over 10 years, how do you actually transition from going from the clinical aspect of working in a hospital or out at patient center or a surgical center, and how do you actually integrate yourself into a company such as this? So we're going to kind of switch roles, and instead of talking about Intelerad itself, he's going to kind of give an overview of that.
I have to say, just at the outset, our company has so many talented clinicians like yourself who did that transition. I have a very topical anecdote, and it is the following. Our newest vice president in our company is a woman named Tara Martris, and she just took over our cardiac imaging division. What's kind of nice about this story is she was involved in cardiac imaging as a clinician. And one day she heard over the hospital speaker that there was a session for training on this new system called Intelerad. And she said to herself, you know what? I'm going to work for that company someday, because if this hospital, which is so good, is adopting this system, I want to learn that. And lo and behold, a number of years later, she found her way to the company. And we are always looking for that combination of clinical expertise and willingness to kind of immerse yourself on the business side. She started out doing a variety of different things inside the company. And now, a number of years later, has just been promoted to vice president to run that division. But it all started with that simple desire of, hey, I'm interested, I've heard about this, and I want to get involved. Is it possible? It's super possible. And I love her example because I think it's inspiring to people who are like, hey, maybe someday I would like to be in management at one of these companies as well.
For myself, and I shouldn't say for other people, for me, sometimes I think about companies such as yours and think to myself, well, I don't really have, I'm an X-ray technologist and I went to school for radiography. But in terms of technology and like computer wise, like I don't have a computer technology background. So you think that it's not really something that you can get into, which is obviously not the case at all.
Here's the dirty secret about technology. Technology, oddly, has very little in the business side. This is going to sound terrible, and I'm going to get a lot of emails from software developers. I call our technology business really a people business. And if you want to be successful in technology, the thing that you need to know, workflow, is the most important thing. And you take it for granted. But the industry insight and knowledge of the pressures and requirements that you have accumulated are extremely valuable. The empathy that you have for how somebody would use our product, extremely valuable. And so we have a lot of people who transition into our company in different roles. And I'll quickly give you the different silos. I don't want to call them silos, but the different areas that you could, let's just say we're going to do your application right now. You could think about, do I want to go into a more support role where I know how the system works and I understand the challenges that somebody is facing so I can answer those inquiries? And that's an interesting role. It's often a role to get your feet wet inside of a company, and then you can grow in that, or you can move over to an adjacent role, which is maybe you want to start learning how to deploy the software. And again, you're not writing the software, but you're understanding, okay, we need to make sure that I have access and that you have access. You have to learn how to use the software, but it's not that different than learning any software program that you probably use in your life today. And then finally, another area that you could think about would be actually selling the software. We have an enormous number of people who are selling the software, but software sales for an industry like this is completely different than what you might think about in other sales contexts if you've seen movies about sales. It's really about selling a solution, understanding the needs and desires of the workflow of the department people are in. I can't tell you how many opportunities exist for clinical people to make that transition. And then, by the way, I've seen some people do that for a while and then transition back to clinical practice. And having been on both sides of the fence, some people say is extremely valuable for helping their department run better and being able to advance in that way as well.
This episode is brought to you by xraytechnicianschools.com. If you're considering a career in X-ray, visit xraytechnicianschools.com to explore schools and to get honest information on career paths, salaries, and degree options.
So the woman that you were speaking about when we start this conversation, did she bring those insights that we were talking, that were
She's fantastic. And I think what she started out doing was working inside of I didn't mention this part, but she worked within the product organization for a while. She helped manage some of the customer elements as well. And all of those things, in each of those things, she had things that she had to learn. But she also brought a basic sort of passion and commitment to the field and to the people she was working with, and that shined through. So one of the things that we do as a company is we invest in helping people learn about what we do. We have a pretty active training program. And also people are pretty generous. It's healthcare, and most of the people are in it for the right reasons. Most people at the end of the day, if you say to them, I want to help somebody get better, that's pretty compelling, right?
Yeah.
People get pretty excited about that. So I think her trajectory is a fun one to talk about because it kind of takes into account the fact that she made the jump. I just find the fact that she heard about it on a loudspeaker and decided that day, this is what I'm going to do, kind of fun. And now I think it reflects well on her, and I think on our company, that you can kind of work your way up and have new opportunities. And I think it's, people gave her very nice feedback inside the company because people inside companies can tell who's in it for the right reasons too. And one of the reasons that I think clinicians do so well and it's not just our company. I think there are many excellent companies out there that would have a similar perspective. So I'm not suggesting that we're unique. I think this is general advice for the industry as opposed to just our company. I think if an industry roundtable, you'd hear a lot of similar sentiment.
You're used within all of radiology. Is it also to Intelerad, transition back to that real fast, or
Sure.
are you used in the cardiac imaging realm as well, since you said that she's part of that? So is that part of say the cath lab and other areas such as that?
Yeah, so our focus is on 3 areas. Well, you could call it 2 large areas. We do a lot with the registry and CVIS, and then our emergent area where we're really focused right now is on cardiac CT, cardiac MR, and cardiac echo. And what we do is we provide a advanced viewing capability that we try to integrate into the larger system so that cardiology sometimes used to be off in I don't want to call it an island, but it was 2 islands in an archipelago, right? They had radiology or cardiology. Increasingly, because of the use of cardiac imaging, those are coming together. So you want to have access to the cardiac imaging for the cardiologist as well as for the cardiac imager who might be a radiologist. And a lot of the same machines are being used to capture, if you're doing coronary calcium measurements with a CT, that same CT machine is being used for a lot of other things. And so you need to make sure that you can bring the right person to bear on all. That's a kind of basic example, but you get my point.
With your software, so for the system that I work for, they have cardiology packs and then we have radiology packs. Yep. Is this merging the 2 of them together, or would they still be separate?
Yeah. No, what's nice about this is it's really the viewer that distinguishes those 2 systems. And so if you can have a system that bridges that with a workflow engine, that That's what I talked about, the workflow piece. You can have the right viewer go to the right person at the right time. All the imaging is in one single repository. That part doesn't need to be segregated by department. And it's a great way to get that cross-functional collaboration, which right now happens, of course, no question. But this makes it even smoother and makes that workflow quicker. You want that data collaboration because, when you're logging into separate systems, you're probably not sharing the information the way you could be. That's our aspiration. So when I talk about enterprise imaging, I think about imaging across the enterprise. You wouldn't lose the distinctive nature of your cardiology analysis. That intellectual exercise would remain intact, but then it would be easier for a cardiologist to collaborate with a radiologist. And my aspiration is not to have to go through any of this, but if I am really sick, the number of different perspectives you need to get that really comprehensive view is significant.
I think there's so much innovation going on out there and so many great ideas happening out there. I'm sure that your company is working on something at this moment too, to either better what's already there or maybe a whole new development. The brains that work behind this are truly amazing.
That's part of, I think, why people are drawn to these multimodal careers, because you get to see it in the field, you get to see it in development, you get to really have a comprehensive view. And as I say, these are not the kind of sales where you sell it and forget it. This begins a lifelong relationship. The biggest decision somebody may make in their career is picking one of these complex software systems. And that's going to define how their department thinks about them, how their colleagues think about them. So it's a big commitment, and we feel the importance of that. I'm sure all of our competitors do too. And as a consequence, the excitement of being part of that, when you make a commitment to somebody, you really feel like you're part of their team too. So we sometimes say within our company, we're part of the care team. And you wouldn't think that necessarily if you were inside, but that's how we think about it. Even though we're kind of very humble part of the care team, we think of ourselves as having a big responsibility to that team.
Is Intelerad solely based in North America, like United States and Canada, or are you also too global as well?
Glad you asked that. We are global. So if you want to think about our span, we have a very large business in the United Kingdom, and that's both private as well as the National Health Service. And then we have a very big business in Australia. And interestingly enough, some of our technology innovations really took root in Australia because Australia is a very big country, very, very big, characterized by large kind of inaccessible parts of it, not inaccessible, but nobody really lives there. The populated areas are somewhat concentrated, but there's still people who need to be reached. And so you need a very agile system to be able to serve a very distributed and sometimes a population that doesn't have great bandwidth access. And so some of the innovations we worked on were to make what we call teleradiology, the telemedicine piece. And that really works well for populations that can't necessarily be in a big urban area where maybe the bandwidth and other pieces are more developed. So worked great for us. And as a consequence, we learned a lot and became a very important part of the Australian healthcare scene. That's fun too. The global piece of this is a lot of fun. And we're looking at more markets as we go, because one thing about, I'm sure you've experienced this, one thing about imaging is it's kind of a global workflow. If you went to a hospital, maybe the language would be challenging, but you could work anywhere. The ways people get treated and taken care of is very similar around the globe. And that's a big advantage from the standpoint of being able to provide systems to people, because other than we have to make the instructions in whatever language is appropriate, the actual system is the same. It would be different if we had to do a tax software system or something. French taxation is very different than British taxation, different than US taxation, but healthcare is very similar.
From a radiology standpoint, I would think, at least from X-ray, like a chest X-ray is a chest X-ray.
Yeah. One of the things that I think is exciting is the willingness, when you're like a big conference like RSNA, the willingness of people from around the world to learn from each other is really inspiring. And in a world today where it feels like it's not easy to get kind of collaboration and cooperation, at RSNA at least, it felt very much like you could see how smart people across the globe were collaborating to try to make people healthier.
right? To share what they've learned to help better. I'm sure many countries have the ability to do more research than others, working with older equipment and things like that, but sharing information, like you said, and research to better help the world as a whole.
Well, this was a lot of fun. I don't know if we had 100% planned on talking about careers and everything else, but it just feels like a very natural fit. And it's kind of fun to talk about with you. I really have enjoyed it.
My pleasure. Everybody, thanks for joining us this afternoon. This is Mars Panner. I'm Jen Callahan on the Skeleton Crew. Make sure you check back next week for another great episode and check us out on Apple Podcasts, Spotify, and then also to YouTube. So Mars, thank you again for being with me. I really appreciate it.
Yeah, this was great. Thank you for hosting me.
You've been watching The Skeleton Crew, brought to you by xraytechnicianschools.com. On the next episode, join us to explore the present and the future of the rad tech career in the field of radiology.